In this video, we'll discuss if surgery can be avoided for rectal cancer. In my previous video, I've already discussed about the role of surgery in rectal cancer, and I've told you how important it is. It's a very important step of rectal cancer treatment when we want cure. But there are some studies in the recent past which have come up with a watch and wait policy, which means we give the patient radiotherapy along with chemotherapy and complete it, and then under certain very strict parameters we watch the patient and wait to see if the cancer comes back. So this is possible only in early stages of cancer, and those cancers which have completely vanished after giving chemoradiotherapy. We prove this, that it has completely vanished by doing a examination, by doing a colonoscopy or sigmoidoscopy, where we put a camera inside and check, and we perform MRI to prove that there is no viable disease. Following that, we have to follow this patient or have a regular clinical follow up for this patient every 3 months. And every 3 months, an examination or digital examination has to be done. An MRI of the pelvis has to be done. MRI is a scan, and that has to be repeated every 3 months. And we have to do a colonoscopy or a sigmoidoscopy to check if there is anything new visible over there, and if needed, biopsies has to be done from the scar tissue also. So this is a very strict protocol. So going through this every 3 months for the first 2 years, every 6 months for next 3 years, and if the no disease is detected at the end of all this, the patient is declared cured. As of today, the data says about 20% of the patients have recurrence in this kind of a protocol. This is in patients who have had excellent response and have chosen to watch and wait. So these patients, about 20%, may end up preventing surgery. So the protocol of follow up should be very, very strictly followed. Otherwise, if you delay too much, you may end up having a recurrence which is very difficult to treat. So a very strictly followed protocol, it is possible to avoid a surgery in a very certain segment of rectal cancers. Thank you.